Hi, everyone. This is Janet Hill with the Rock Island County Health Department. Thank you for joining us. Today, we are going to talk about the Quad City Disaster Recovery Fund and how it has helped during this economic devastation brought on by the pandemic, especially for our local nonprofits. But first, let's start out with some numbers. Nita, what is the situation in Rock Island County today?
Good afternoon. Today, Rock Island County Health Department is reporting 26 new cases of COVID-19, which brings our total number to 2,597. The total number of deaths in Rock Island remains at 71, and currently there are 14 patients hospitalized in Rock Island County.
Okay, Ed, how about Scott County?
In Scott County, the Iowa Department of Public Health reports 2,430 cases. In addition, IDPH has announced an additional death of a Scott County resident. This brings our total to 24. We're saddened to hear the death of this member of our community, and we know that the most vulnerable members of our community bear the burden of COVID-19. We hope we can work together to prevent the spread of this virus. As humans, socializing is in our DNA. This makes staying at home, social distancing, and changing our behavior all the more difficult. We recognize there may be members of our community who attended Labor Day gatherings, and if you were in close contact with others, you may have been exposed to COVID-19. If you fall into this category, please take these steps to protect yourself. When you go out, wear a mask and stay at least 6 feet apart from others. Watch for any symptoms: fever, cough, shortness of breath, trouble breathing, new loss of taste or smell, diarrhea, muscle aches, and severe headaches. This is a new ask, but it will help you if you are contacted by our department. Write down who you were with and where you went in the days before you became ill and after you became ill, and then answer the health department's calls to tell you you've been exposed. If you feel sick, stay at home. Get tested, call your health provider, or visit www.testiowa.com and inform people who you were with of your symptoms and your test result.
Okay, thank you, Ed. Now we're going to talk with Kelly Thompson. She is the Vice President of Grant Making Community Initiatives with the Quad Cities Community Foundation, and she is one of the leaders in the Quad Cities Disaster Recovery Fund. Kelly, go ahead.
Thank you, Janet, and hello, everyone. Glad to be here this afternoon. So one of the most important things that I want to say first is thank you. Thank you to about 1,400 donors who have, over the past several months, made contributions to the Quad Cities Disaster Recovery Fund at the Quad Cities Community Foundation. It's because of those donors and because of the resiliency and innovation of the nonprofits that have received grants from the fund that I'm able to share this update. So can't say it enough. Thank you, thank you, thank you. I also want to make sure that I clearly say that we continue to raise dollars for the fund. As we all know, as we're hearing from Ed and from Nita today, the COVID-19 pandemic is not over, and our regional community is feeling both the immediate and long-term impact. So the fund continues to accept donations, accept applications from nonprofits for assistance, and grant dollars are going out pretty much every week to support recovery efforts. People can give online at qccommunityfoundation.org. To date, more than $1.3 million has been raised for the Quad Cities Disaster Recovery Fund. And as I mentioned, over 1,400 donors have given. In partnership with the United Way of the Quad Cities and the Regional Development Authority, we review and grant out those awards. And we follow issues identified by the Recovery Committee of the Disaster Ready Quad Cities. If you'll hold on 1 minute, I'm going to switch from my headset to my speakers because, well, I was going to switch, but my battery is fine, actually. If holler at me if you stop being able to hear me. So we've made, at last count, 74 grant awards totaling just over $1 million. Those grants have supported a wide range of recovery efforts on both sides of the river. Just a few examples: individuals in need have been served by the organization Alternatives for Older Adults, which provided direct support to seniors. Community services have helped businesses, like the grant to the Greater Quad Cities Hispanic Chamber of Commerce, which offered critical business education and support services to minority-owned businesses. It's supported programs to engage children in learning, like SAL Family and Community Services, which provided childcare for essential workers for families with parents providing those essential services. We've supported the distribution of community action and safety information through a grant to WVIK Quad Cities NPR to expand their news and reporting to keep you all as community members educated about the pandemic. And of course, as you'd expect, there have been significant grants for the key needs of health, food and shelter, crisis financial assistance for households through great organizations like Community Healthcare, our local community action agencies, Humility Homes and Services, the Salvation Army, Quad Cities Open Network, which serves as a central pool of funds that gives crisis financial assistance to clients of over 50 local human services agencies. So I can't list them all, but I'm glad to share those examples. And from then, we know there is more need. We continue to get grant requests. We're committed to ensuring that the gifts that have been donated to the fund go right back out into the community to meet needs now and as long as we can into the future. As I mentioned, we are hearing, of course, the data and science tell us this pandemic is not over. That means we're a long way from complete recovery. The Community Foundation continues to welcome gifts to the fund. Donors can send a check to the Quad Cities Community Foundation or visit our website at qccommunityfoundation.org. Click that orange box at the top of the page and give online. Now I'm really happy to turn it over to my partner here today. We know the power of what's happened in the recovery effort is best explained not in numbers or even the quick list I was able to give you earlier, but in the real resilience of the nonprofits and the creativity and the innovation they've mustered up to support the people and communities that they serve. So I'm very pleased to share one of those stories to introduce Laura Fontaine, Director of World Relief of the Quad Cities, to talk about the work made possible by one grant from the Quad Cities Disaster Recovery Fund.
Thank you, Kelly. First and foremost, I'd like to thank the Quad Cities Community Foundation for their generous support and all the donors throughout our community. World Relief Quad Cities is a nonprofit agency providing services to refugees and immigrants in Western Illinois and Eastern Iowa. Through partnerships with local churches, agencies, and the community at large, our agency provides financial, emotional, cultural, and spiritual support to refugees, victims of war and persecution from around the world, who are being placed in the Quad Cities. Our integrated refugee program is designed to assist refugee families in obtaining self-sufficiency and interdependence through services including resettlement, economic development, employment training and placement, English language services and training, and cultural orientation. Our office began serving refugees in 1999 as a sub-office of World Relief Chicago, and we soon became our own entity. We have served more than 1,034 refugees in the last few years in Rock Island County. These refugees have come from Southeast Asia, Africa, Eastern Europe, the former Soviet Union, the Middle East, Latin America, and the Caribbean. World Relief also continues to serve hundreds of secondary migrants who have relocated to the Quad Cities. We are all affected by the corona outbreak and its consequences. Refugees and immigrants are affected disproportionately. While we are all grappling with this crisis in one way or another, vulnerable refugees and immigrants are facing an increased risk due to a host of barriers, such as language barriers, making the rapidly changing information difficult to understand and take in. Some of our families are illiterate, so needing visual and audio in their native language, accessing reliable information and social support, and lack of transportation and technology. In the beginning of the pandemic, many of our families we served reported that they were hearing conflicting information from schools, businesses, the news, basically causing confusion. Additionally, throughout our ethnic communities, a cultural stigma is attached to this virus like other diseases. So comprehending the gravity of this virus has been really hard for our families in these communities. Our families also come from a very communal society, much more than even the American society, where social distancing doesn't really exist, especially when they're relying on each other for support as they integrate and understand our new country. Funding from the Quad City Disaster Recovery Fund allowed us to hire 3 bilingual staff members in order to focus on community outreach and education of COVID-19. The team completed the World Health Organization certification on the coronavirus disease. The outreach team focused on reaching out to the ethnic community leaders and ethnic pastors to provide them with education that they can relate to their communities. They contacted individual ethnic families to ensure they were understanding social distancing, knowing what self-quarantining meant, having a mask, and help liaison with their employers to ensure paychecks were still being sent, and if they did get sick, how to call out of work correctly. They also utilized a crisis communication plan to provide public health information and other critical communication in appropriate languages to as many unique immigrant communities as possible. They used the social media platforms such as WhatsApp, YouTube to help with education. In partnership with Unity Point Health and the John Deere Foundation, our outreach team was able to distribute 150 COVID boxes to our families. These boxes were filled with cleaning supplies, disposable masks, gloves, COVID educational materials in English as well as their native language, paper products such as toilet paper, paper towels, disinfectant wipes. And these boxes were used as teaching tools that allowed our outreach team to explain COVID protocols. We were able to set up a testing site with community healthcare to provide free testing for all World Relief staff, volunteers, and all of our families, and provide written, visual, and audio information in native languages. Overall numbers of COVID-19 patients in the refugee and immigrant communities are decreasing. Our work has allowed a greater understanding of the virus within our communities, and we have helped residents take the measures to stop the spread. Nevertheless, there's still a pandemic going on, and we still need additional funding and help in order to ensure that everybody is getting educated. Everybody knows the safety protocols and has the goods that they need, such as masks and gloves, in order to not spread anything. So thank you once again to the foundation and to all the donors throughout our community. We truly appreciate it.
Thank you, Kelly and Laura, for coming on and talking about your mission and of how others in the Quad Cities can continue to help. Any media partners, if you have questions, please put them in the chat. And that would be, that could be for Ed or Nita or Laura or Kelly. Looks like, is Rock Island County out of warning stage? Nita, would you like to address that?
Sure, I'll take that one. So the reporting period that we were in the warning stage was actually through the end of August. Those are always a week behind. So we're expecting to see that first week of September posted tomorrow. And while we may not be in the warning stage as of tomorrow, we're not sure yet, but it will depend on how many counties in our whole region are in a warning phase. And if they are, enough of them are in the warning phase, we could see some mitigation efforts in our region. We won't know that till around noon tomorrow.
This is another question for Nita. What numbers do you have for the East Moline Correctional Center? And are there any new cases today?
There are no new cases today. We did report, a couple of hundred last week, I believe it was. And those numbers are on the Department of Corrections website. However, their testing usually comes in once a week. So we may still see those tomorrow or even Saturday. We may see some more numbers from the East Moline Correctional Center. And whenever we get those, we will let you know that that is the number from that facility.
I just went ahead and posted that link into the chat. It is always included in our COVID media release from the coalition as one of the helpful links at the bottom, but here it is in the chat again. Is the fact that Rock Island County has nearly 3 times as many deaths as Scott County attributable to nursing homes, Tyson, and East Moline Correctional Center, anything else? Nita, would you like to start?
Sure. For Rock Island County, there are only 2 deaths associated with the Tyson plant, and I don't believe there have been any deaths associated with the East Moline Correctional Center outbreak. There are several deaths, of course, from the various long-term care facilities in our county, because those are really our very most vulnerable populations, as you know. And a lot of times COVID-19 is far more serious and deadly with elderly people, and especially with those that have underlying health conditions as well.
Okay. Any other questions? Do nursing homes then account wholly for the disparity? Ed or Nita?
I'll take that first, and then Ed can certainly speak about Scott County. But I think we're still new enough into this virus that we don't know the full effects on all of the population. We've certainly seen people that don't have any underlying conditions and are younger that have had serious illness be put on ventilators, and even a couple, unfortunately, have passed away. So while in general it affects a lot of the elderly folks in our long-term care facilities, that doesn't mean everyone else is immune to this virus. In fact, nobody's immune to this virus at this time.
Ed, would you like to add anything to that?
In Scott County, a majority of the deaths have been in the older population, and some have been residents of nursing homes.
Okay. What are some things that they could do to prevent deaths? You mean nursing homes? WVIK? Are you talking? Yes. Okay, so what are some things that nursing homes could do to help prevent deaths? Ed, you want to start with that, please?
Well, employing good social distancing discipline, wearing masks, sanitizing, making sure that your staff are well aware of how their behavior affects their residents. All of those things play a part. By and large, our nursing homes have been very successful in that there haven't been many cases in, I say nursing home, but long-term care facilities is a generic term, and that's to what I refer.
Does the Iowa Department of Public Health have a listing of long-term care cases and deaths posted on their website?
When there is a declared outbreak, the Iowa Department of Public Health will announce that we've only had 2 such cases in Scott County, and the numbers were quite low.
Okay. Nita, is Rock Island County Health Department still working with long-term care? And that, how are we doing that?
Absolutely. So our nurses are conferring with the long-term care facilities each and every day on their clients that have COVID-19 and the precautions that they're taking. In Illinois, the long-term care facilities are also regulated by the Illinois Department of Public Health, and so they are working with them as well.
And then the health department also has been giving PPE to nursing homes since the beginning of the pandemic.
That's correct.
Any other questions? Do we have any idea why there is such a disparity in deaths between the 2 counties in long-term care? I think Ed started to address that, yes. Oh, I'm sorry, she is speaking about the death rate in general. Would you be a little bit more specific, Barb?
You know, if it's just the difference between Scott County and Rock Island County that she's referring to, I don't think we have an answer to that, and I don't think we will have an answer to that anytime soon. I think, you know, once the pandemic is over, I'm sure statisticians and epidemiologists will be studying all of this data for years. But at this moment, I can't speak to that.
Ed, would you like to add anything?
No, we've been, despite the number of deaths in both Scott and Rock Island County, we haven't seen the type of occurrences in long-term care or other institutions that other parts of the nations have, and the number of deaths that are in other counties. I can't speak to the differences between Scott and Rock Island.
Okay, thank you. Do we have any other questions? If not, we'll be signing off for today. This is the last planned media briefing for this week. We expect to be back with you on Tuesday and then again on Thursday next week. All right, well, thank you everyone for your time. Thank you to our speakers, and we'll talk to you next week.